Welcome back from that break. Now it's time to have a very important conversation about health. Measles is a very contagious disease when it comes to health, especially in our young children. And in recent times, there's been a rise in diagnosis in children. So it's very important that we have these conversations. And the Ghana Health Service has launched a campaign, a national measles, rubella and vitamin A campaign, and we'll be talking all about that this morning. Joining us in the studio to have this conversation is Emmanuel T. Sully. He is a part of the extended program on immunization from the Ghana Health Service. Good morning, Emmanuel.
Good morning.
Good to have you in the studio.
Great. Nice to be here. Thank you.
Fantastic. Now, just walk us through the current situation when we look at the measles, the state of measles, rubella, and then you're also campaigning on vitamin A. Why that is also important.
Okay. Thank you very much, and greetings to all cherished listeners and viewers, and to the Director General Ghana Health Service and team and the program manager who I represent. So, measles, currently Ghana is recording some increasing confirmed cases. Actually, the important thing is that it's a disease that has been with us, and even before the inception of the expanded program on immunization, whose mandate is solely to ensure that all vaccine preventable diseases are brought under control, elimination, or eradication. Measles was there. And so when the global launched EPI in 1974, Ghana adopted in 1978. At the time, what we call the 6 childhood killer diseases included measles.
Yeah.
Right.
And so Ghana have been fighting that. Actually, data suggests that if you look at diseases or events causing death in children, measles was second to malaria. So that gives you not just the global picture, but the context as in Africa and Ghana, our situation. Specialists who have worked for several years will tell you that any time they go to the consulting rooms, they saw pile of kids dead as a result of measles when they started medical practice.
Okay.
These have declined over time, except for 2022, 23, and now, where cases are rising up close to about 1,200 confirmed cases over the period. By half year 2024, we had about half of that, around 600. And we have declared outbreaks in pockets of districts. That alone in 2023 was about 52 districts in all, out of the 261. It's still an issue we need to take care of. I see the slide. I don't know whether viewers can see this slide.
They can.
But it walks us through the trajectory of measles, triangulated not just with the cases, but also with the vaccination coverages from 1994 to 2023. Now, the bar chart speaks to the cases that were picked up in individuals as measles suspected. You'll notice that when immunization was a bit new, coverages were around 50, which is the line graph. As the line graph peaks, the red bars declines. The reason is that we are getting more protection among persons at the community level. Now, you will see a blue line showing an arrow down there, close to about every 4 to 5 years.
Okay.
What does that depict? That is a measles campaign. So ordinarily, when we are doing even 100% of measles vaccination, there are pockets of people who will still not get the protection. That 10% or 5%, if you take our country cohort currently, which is about 1 million, that means close to about 100,000 children are not protected. That over a period of time, if you say 5 years, that's 500,000. That cohort is enough to spike an outbreak. So what we're doing as another layer is every 4 to 5 years have a campaign. And once the campaign comes, it dips the burden. And so if you check the last time we had a campaign in 2018, another one was ideally supposed to be around 2021, 22, which we were not able to have. And so cases are spiking up again. This campaign is expected to reduce not just the numbers, but also add additional protection to our susceptible kids at the lower level.
Now, Emmanuel, I was wondering, the age bracket, we are talking about children under the ages of 9 months to maybe 5 years. Why this specific age bracket?
Okay. So this group appears by data to be the most vulnerable. In routine immunization, we give our measles rubella vaccine at 9 months and 18 months. That's a 2 schedule. Now, when you do have outbreaks, you look at your epidata and determine the scope, as in cases that are coming up. Cases that were coming up spans close to even 15 years of positivity. But for public health good, you maximize on reaching a chunk of the age group that you hit your maximum level of protection. And the age 9 months to 5 years, up to 5 years, gives a broader scope of reaching out to the persons or groups that are more eligible. It also aligns with the program's vision, which is handling vaccinations across all groups, but especially among children under 5.
Now, talk to us about rubella. We've known about measles the whole time. Is rubella a new thing? What is it?
Okay, good. It's great to know that measles we know about, but rubella have been silent. Rubella isn't new. This is otherwise called the German measles. So rubella presents same like measles do, except that it comes quite milder. Measles hits harder. Now, in terms of mode of spread, the droplets, all that. And the other unique thing about rubella too is the fact that it could also be shared transplacental. That means pregnant women could get this to their unborn kids.
Wow.
The worry for us, because I mentioned rubella is quite milder, it's on the child. If we do have mothers transmitting this to their kids through the placenta, they eventually develop the CRS, the congenital rubella syndrome. That has a lot more complications that could lead to blindness, it could lead to autism, it could lead to some death. And in most instances, you have new kids, so that image is very specific. That child has a cataract, that is a white coloration in the pupil. And so rubella isn't new, has been with us, but we introduced a vaccine for it around 2012, 2013 as a country. All this while, it's been something that has been under surveillance from that time.
But has there been any reported cases of rubella in the country? Or how high is the cases of rubella as compared to measles?
Good. So we've had cases and we still do get cases of rubella. In fact, initiating the surveillance system and showing the burden was through the cases that were reported. Because there were instances, cases with the classical signs and symptoms, the fever, the rash, the corpulent spot and all that, were picked up with samples. Results for measles ended up as negative. But eventually when tested for rubella, were positive. And so that started a discussion. But good to know that all this, with vaccine availability, the trend have been declining until the recent mishaps that occurred.
So for our viewers that are watching, I mean, what are some of the practical steps that parents can take to make sure that their children neither get measles or rubella?
Okay, good. So every child is at risk of getting measles and also same as rubella. Now for our caregivers, essentially because of the mode of spread, and we are talking about droplet spray. So now where we ensure sanitation is crucial. Good ventilation is good. Personal hand hygiene is much recommended. But more importantly is when there are vaccines available to handle this. we always encourage that they ensure their kids not only take advantage of the routine vaccinations that exist where we have measles and rubella, but also when there are opportunities like campaigns this way, they also do take the vaccines to ensure optimal protection for their kids. To add up, anytime they see things like the rash, the fever, the spots and all that, they should just rush to the nearest health facility. And this is very helpful as a first step, because it's more, in most instances, the stage where you are seeing the rash is actually quite too late. That person was previously highly infectious. So if it's in a school and a child is now showing a rash and the teachers advise they don't come to school, so mother take care of it, the tendency that the kids around days prior to the signs and symptoms showing the main rash got infected were very high. That makes it very, very contagious.
What about the vitamin A aspect of the campaign? If you can just touch on that.
Great. So vitamin A on routine basis is given to, currently in our schedule, children starting from 6 months and repeated after every visit at the health facilities. Once we want to talk about holistic health, it means that using the opportunity of the campaign to reach out to all kids within 9 months and up to 5 years gives us an added advantage of ensuring that we supplement these children with a vitamin A. Vitamin A essentially helps with vision. Ideally, with good nutrition, and I want to say eating Ghana. So where Ghana is talking about the colors. So anything red, yellow, green. So start from red, tomatoes, you go to yellow, carrots and the others, you go to green, your cucumber, all those stuff, even dawa have great sources of vitamin A. So what we do with this oily products is to supplement and help their nutrition, not just the nutrition, but their sight to be very good. And that gives them a holistic health. So it's a great opportunity we have to reach out to all children 9 months up to 5 years for vitamin A.
Now, for parents who are in very remote areas who may not get access to this information, what's the plan to roll out the campaign to them?
Great. So the Ghana Health Service structures leaves no level untouched. Yes, we are the headquarters, but we run a hierarchical system where at a click we can reach out to the lowest facility as a chip zone, which manages a designated area. So with that structure, all regions, districts, sub-districts, health facilities, and those in close contact with communities have gone through sensitization, some trainings, and we also work in close collaboration with volunteers. And the volunteers are part of our households. So i.e., with information dissemination across this hierarchy, it gets to the volunteers at a lower level. Kind courtesy, the media, social media in general, and other partners, handles are circulating and distributing leaflets, easy to read key messages to alert them about this information. So a lot is ongoing throughout the system to ensure that people get to know about it and on board for this particular exercise. We haven't left our religious leaders, opinion leaders, so the mosques, the churches, the queen mothers. We are using all structures available to ensure that we can reach out to the people who matter, and then we get a total success for the campaign as we plan.
When is the campaign expected to start?
Great. The campaign is starting tomorrow, 2nd to 6th.
Okay.
That is nationwide. So everywhere you find yourself in Ghana, whether you are a Ghanaian or not, so long as you are in the catchment map of Ghana during this period, irrespective of your vaccination status, you are eligible if you aged between 9 months to 5 years. And all these services are going to be provided free of charge. Today, an activity is ongoing to climax the sensitization, what we call the launching, and the Director General and team is having that launch for us.
Right. Now, I got measles at the age of 10. Is it common for children that old to still get measles?
Yes, it is common, but not very. So that's why I had mentioned in my submission earlier that the outbreaks that we had, we got even cases in about 15-year-olds.
Okay.
So it supports the statement I said that all children are vulnerable or susceptible to getting the measles. Now, what reduces your chances of getting is your previous history of exposure, i.e. vaccination or by natural exposure. So the truth is that if you are a kid and somebody gets it in class and you get exposed, you would fall sick with the measles and be noticed. There are a few of them that they won't actually fall sick, but they have some level of protection. And so you may not actually come down with measles in a heavy way or rubella in that way. So the catch point is that all kids are vulnerable, but the most at-risk groups that we know of and data supports is the under 5-year-olds.
Wonderful. Thank you. Thank you for coming.
Thank
Any
you.
final thoughts quickly?
Yes. So to sum up, measles is highly contagious. All children are vulnerable. The health system is doing a lot to handle measles rubella. This particular campaign gives us additional opportunity, irrespective of the children's vaccination status, to get the vaccine. On the 2nd to the 6th, let's visit the nearby posts, get the shots, get protected. If we have any concerns, let's reach out to the nearby health facility for assistance. This does not take away our routine immunization. So parents are still encouraged to take their kids for routine immunization services.
Wonderful.
These are my last words.
Thank you so much, Emmanuel.
Great. Thank
Right.
you too.
Thank you.
Good.
So we've been speaking with Emmanuel T. Sally. He is with the expanded program on immunization with the Ghana Health Service, of course, which begins tomorrow, and make your way to the various centers around the city and the country to get your children immunized. We'll take a quick break and we will be right back.